Can light therapy help with insomnia? If you're struggling with insomnia and wondering if light therapy could be the answer, you're not alone. Many people have turned to light therapy as a potential solution for their sleep issues. Let's break down how it works and what the research says. Light therapy involves exposure to a light source that is brighter than typical indoor light, but not as bright as direct sunlight. This is usually done using a light box, which you can use from the comfort of your own home. The key is to use it at the same time every day to help regulate your circadian rhythm. Your circadian rhythm is essentially your body's internal clock, which tells you when to be alert and when to sleep. When this rhythm gets disrupted, you might experience symptoms like daytime sleepiness, insomnia, or even depression. Light therapy can help reset this internal clock. For people with insomnia, light therapy can be particularly helpful. Studies have shown that it can improve sleep efficiency, reduce the time you spend awake after falling asleep, and even advance or delay your sleep-wake cycle depending on your needs. For instance, if you have advanced sleep phase disorder, where you feel sleepy early in the evening and wake up too early in the morning, light therapy in the early evening can help adjust your internal clock. On the other hand, if you have delayed sleep phase disorder and stay awake late into the night, morning light exposure can help you feel more alert during the day and sleep better at night. Research has also shown that light therapy can significantly improve sleep in patients with Alzheimer's disease and dementia, reducing sleep disorders and psychobehavioral symptoms like depression and agitation. However, it's important to note that while light therapy shows promise, the effects can vary. Some studies indicate that the improvement in sleep is more noticeable in subjective measures, like how you feel about your sleep, rather than in all objective measures like total sleep time or sleep latency. To use light therapy effectively, you need to follow a few guidelines. Typically, you should use the light box for about 20 to 30 minutes at the same time each day. The timing is crucial. Morning light exposure can help regulate your day-night cycle, while evening light can sometimes disrupt it if not used correctly. In summary, light therapy can indeed help with insomnia by regulating your circadian rhythm and improving sleep quality. It's a treatment that's worth considering, especially if you're looking for an alternative to traditional sleep medications. Just make sure to use it consistently and at the right times to get the best results.